Now, if you're a runner, chances are you've experienced some sort of foot pain over the years. It may be serious, or it may be absolutely nothing. Now, sometimes a small twinge in your foot can be completely ignored and you can carry on with your running, but other times it's really important that you back off right away, you recover, and you avoid it from becoming a more serious injury. And it can be very confusing and hard to tell which is which and when you need to do either or. So in today's video, I thought I'd delve into this broad world of foot pains and injuries, and I'm going to be running through some advice that's out there in terms of recognizing what your injury is and the type of foot pain that you're getting, how to recover from that, and of course, how to avoid it altogether. Now, obviously today's video and the information in this video is certainly not a replacement for a trained medical practitioner. Now, if you sense that you have a serious injury or you are simply unsure, then they should definitely be your first port of call. But in today's video, I am going to be running through the most common types of injury and explaining what they are, how they may feel. So if you are unsure, then that may help you. And then also hopefully giving you the tools to help manage your body better and help that injury. So if you have got pain in your foot, then some of the first things you should be thinking about are, where is that injury in the foot, or where is that pain? When are you experiencing that pain, i.e. what are you doing? And is there anything that you do that helps it, makes it better, or makes it worse? Now, I know they're pretty obvious things, but it's amazing how many people don't take the time to take a step back and think about those, because then it can allow you to identify what the injury is and what the issue is, and therefore the treatment needed for it, allowing you to recover and hopefully prevent you from having that same injury in the future again. So now let's talk through some of the most common injury types. And of course, there are a whole host of different variations out there, but generally speaking, the treatment and the preventative measures for them are pretty well aligned. Now, generally speaking, pain in different parts of your foot will be caused by different irritations or weaknesses in the many tendons, ligaments, muscles, or even the skeletal structure that makes up your foot. Now, pain in the underside of your heel that can also run along the bottom of your foot into your arch could be plantar fasciitis. This can be painful when you first step out of bed in the morning or after long periods of rest, and presents itself as a stabbing pain. Inflammation of the plantar fasciitis tendon is the most common cause of foot pain and is a form of tendonitis. It is typically categorized as an overuse injury. And following on from plantar fasciitis, we have tendonitis itself. Now, tendonitis most commonly presents itself as pain in the arch of the foot just here due to inflammation of the posterior tibial tendon. And that tendon supports the arch and runs along the insides of the foot. And when inflamed, it can feel like a stabbing or throbbing feeling in the arch, either when running or even after running. Now, that along with plantar fasciitis are the two most common tendon injuries in the foot, although tendonitis can also present itself in any of the other tendons in the foot when they're subject to a significant increase in workload. And I actually have experienced it just a couple of years ago along the top and the front of my foot, and it took quite a while to recover from. Now, moving on from the tendon issues, we've got stress fractures. Now, these can be equally frustrating and can occur in any of the bones that make up your foot, but most commonly occur in the metatarsals. The stress fractures usually build up over time, but then suddenly present themselves as a sharp pain, which can be confused with tendonitis. Even X-rays, unfortunately, can struggle to pick up stress fractures. So one hack, if you can call it that, to try and identify as to whether it's a stress fracture or not is to hop, obviously small and gently, on the problematic foot. And if you feel a sharp acute pain, well, unfortunately that could well mean that it is a stress fracture. And now moving on to a different type of injury, bursitis. Now, foot bursitis is very common in athletes. We have a fluid-filled sac in our foot called bursa, and if that becomes inflamed, well, it can be rather painful, it can be sore and inflamed and swollen, and also rather red. Most commonly, this pain is at the back of your heel. It can be quite disabling and painful to touch. It'll be painful to walk and run, with pain increasing when you stand on your tiptoes or bend your foot. Foot bursitis can occur through repetitive actions, impact, or simply being on your feet too much. Okay, and a final issue, if you're experiencing pain in the arch of your foot or under your toes and quite often find yourself unable to or struggling to walk after a long run, then it could well be metatarsalgia, which I know sounds like a made-up word, but it is in fact pain and inflammation towards the head of your metatarsals due to increased pressure on a small spot of your foot, and therefore obviously taking quite a pounding. As with many of these injuries, there is a direct result of quite often increasing your training volume too much and too quickly. So hopefully describing those common injuries has helped you to understand or maybe figure out what is going on in your foot. To be honest, normally just identifying is one of the hardest parts of the process, and from here on, now it's just a case of addressing them and treating it so that they recover and you can get back to running. So if you are experiencing pain in your foot that is stopping you from running, or it's getting worse when you're running, then the advice is to stop running for 72 hours at the very least. Rest the foot, ice the foot, take an anti-inflammatory such as ibuprofen if suitable to hopefully bring any inflammation down. Following this period, you can test your foot to see if the pain remains. If it does, then immediately ease off whatever you're doing. Try gentle strengthening exercises such as calf raises or ankle mobility work, but avoid anything that causes pain. The best remedy for most of these injuries is either reducing your run volume and intensity significantly, or time away from running altogether until the pain is no longer present, allowing you to build back up slowly. We've mentioned this before, but make sure you see a physio or doctor if injuries do persist after just a couple of weeks. Now, the next part of the puzzle is actually identifying the cause of the injury altogether. Now, there is a list of the usual suspects when it comes to these causes of injuries, so it's a good idea to start by working through this list as a process of elimination and finding out which one is, or multiple things, are the cause for you. So first up, running shoes, and these are often the first thing that runners look at when they get injured. Have you just changed brand or model, or are your trainers worn out so your foot is now moving around with no support, or do you even actually have the right support for your foot in the first place? Now, running shoes get mentioned a lot, and this is because the support they provide, or don't provide as may be the question, can be the answer to a lot of issues, and injuries such as plantar fasciitis can be resolved or prevented by using a more structured shoe or even an orthotic inner sole. It's also good practice to rotate the trainers that you run in. This is a really neat trick that will strengthen all the muscles in your foot and lower leg to give you an all-round resilience against injury. Next up, we want to look at your training. Have you recently significantly increased your training volume? If so, your body just may not have been ready for that level of overload, and it's resulted in this breakdown, irritation, and failure of your muscles, ligaments, and tendons. So have a think back to the training that you've recently done, or maybe you've got it in a plan that you can take a look back at. Ideally, you want to have these periods of recovery after these periods of overload where you've increased. If you have just increased your training over time with no recovery, or just suddenly and quite instantly, then your body just may not have had time to adapt. So going forwards from now, you want to factor in these periods of recovery and allow your body time to adapt and absorb all that hard work. And then could it be due to an impact, a twist, or a fall, or something similar to that? Have a think back, try and recall, have you had any incidences like that over the past months? Because as small as they may seem, they can be exacerbated by training on top of them. I remember just twisting my ankle and thinking nothing of it at the time, but 50K later and later into the week, I had a full-blown injury that I struggled with for the next few weeks. So listen to your body. If you have a current injury that you're trying to get over, then make sure you give yourself time to recover from that. There is no point trying to train through them or trying to train through little niggles, because you could well prolong them, make it worse, and you find yourself just limping along for months on end. And also, could it be sleep and diet? I know it sounds odd, but have you recently had a period of poor sleep or poor diet? Both of these factors can actually have a significant impact on our susceptibility to injury as our body becomes less robust to the stress we put it through in everyday training. It's good practice to monitor sleep quality and quantity. This doesn't have to be an exact daily metric, but remaining aware of how well you're rested will give you a good indication of when you can handle high training load or when you need to back off and give your body a bit more TLC. And finally, we've got running dynamics. Now, this is an important one because our running dynamics can be the cause of some long-term injuries and can also be one of the hardest to fix because our running technique and form is almost ingrained into us from years of running. It can be simple things as little as heel striking. That's creating excessive force through our foot and our lower limbs each and every time we strike with our foot. Or it can be weakness through the stabilizing muscles in our hips and our glutes, and that's leaving our foot quite exposed. There is no one size fits all when it comes to running dynamics. However, there are certain things such as weak or imbalances in our gait that do regularly cause running injuries. Now, I would recommend heading on over to our channel, checking out some of our technique videos, form videos. We also have a ton of drills on there, which I really would recommend because that will allow you to work on good technique and also working on some of those weaknesses. If you have any questions, please do drop them in the comments section down below. Of course, if you do have a big injury or something that's causing a lot of pain, you've been out of running for a significant period of time, I would seriously recommend getting some expert professional advice and even heading into a run shop to have your shoes looked at and your gait. Now, do remember you can head on over to our GTN social media channels, give them a follow, and don't forget to give us a subscribe just down below.